Okay. Yes, that's correct. Dysfunctional uterine bleeding. It's not called that anymore. It's called abnormal uterine bleeding. The nurse should be aware that
Is it D?
no, actually, it should be B. That's another one you have to look up because your professor doesn't know what the book says. Can go by my experience, but you have to know what the book says. Okay. Which health risk is not associated with menopause?
B.
Is it A?
Thinking B also.
When a woman goes through menopause, what is she at risk for? In other words, her hormone levels are dropping off.
A.
Osteoporosis.
Obesity.
A woman's at risk for osteoporosis without adequate estrogen and progesterone. Coronary
Yeah,
artery disease. Huh?
When I read the question, I didn't see the not associated. I was just reading it as associated.
Ah, yeah,
Me too. Me too.
yeah.
Yeah, but can't weight gain or excessive weight gain be a hormonal issue also, which can, your hormones change when you're going through menopause?
Yeah. Yeah, but those other ones are for sure. Okay. But we need to look these up in the book. We'll go through them and do that. A nurse counseling a client with endometriosis understands which statements regarding the management of endometriosis is accurate.
C.
Yes. I do know that for sure.
That's all that
All
applies.
right.
What were the other
All
ones
that
that said
apply,
all that apply?
Professor. Yeah. So I think D is one of them too.
Oh, okay. So D, women with mild may want a future pregnancy may take non-steroidal.
D. Let's see.
I think B would be one of them, right?
Steroid.
Doesn't it cause like facial hair growth and things like that too?
It might. Yep. We'll look that one up too. Okay. Number 10. There's a lot of stuff in here. Okay. Nurse should include obviously I didn't look at these slides before class. The nurse should include which information when teaching a 15-year-old about genital tract infection.
Definitely going to be B. D.
E.
And E. F. C.
Let's
All the
see.
above. Oh wait, use floral. Oh no, yeah, you wouldn't want to use floral scented bath salts.
Yep. Decrease sugar intake.
It's
Yeah.
I think it's saying at the bottom, if you pull up on the notes part.
B and D.
Yeah,
Well,
but
actually, do not douche either. You'll upset your normal flora. So do not douche is an answer here. Let's see if it's on here. Yeah. Limit the time spent wearing a wet bathing suit. Do not douche. Decrease sugar intake. So why do we want her to decrease sugar intake? Anybody know?
Does the sugar feed the bacteria?
Yeah. And the reason, if you think about a diabetic, they're susceptible to infections and candidiasis, fungal and yeast infections. So, yeah, so if their levels of sugar are high, they're going to have a lot of vaginal infections. I couldn't do this without you. All right, let's go to the next chapter. All right, 28-year-old client presents to the clinic to discuss contraceptive options. She notes that she's in a committed relationship and wants to hear about different methods to prevent pregnancy. During the nurse's discussion and assessment, the following findings are documented. She's got a good blood pressure. Okay. Her pulse is 68. She's got asthma. She's allergic to latex. Wants to use a method that she can control independent of partner. Last pap test was 18 months ago with normal limits, normal results. Body mass index is 24. She'd like to become pregnant in about 4 or 5 years, would like to avoid estrogen containing products, and would like to use a highly reliable method.
He wants a lot.
Yep. Independent of her partner. History of asthma. Okay. Based on what she wants, what are you going to recommend? You have any idea?
6?
Mm.
Oh no, that's probably releases
Copper
estrogen.
IUD, maybe?
Oh, it is.
Is the copper IUD up there? Nope.
No.
So we know it's not combined oral because that's going to have estrogen in it. Okay. A male condom, well, that would be dependent on the partner. Okay. Bilateral tubal, no, because she wants to have children. Hormonal IUD, yeah, because that's just progesterone.
Mhm.
Fertility awareness method, possibly. Means that she knows when she ovulates, but it's not super reliable. So let's remove it. Contraceptive sponge. Not as reliable. Injectable progestin. Yes. Vaginal contraceptive ring, like NuvaRing. No, because it's got estrogen and progesterone in it. Coitus interruptus is not reliable. Choose the most likely options for the information missing from the statements below. Okay. Based on the client's assessment data and preferences noted above, the nurse proceeds to teach the client about contraceptive options. there are several types of hormonal IUDs. Some of the main advantages of this method are that they are highly reliable and, well, they're highly reliable and what? Intrauterine devices.
Reversible?
Yeah.
Yes, because you can just remove it and get pregnant the next time you ovulate. There's no delay, okay? These IUDs contain the hormone what?
Progesterone?
Yes. Which prevents pregnancy. The contraceptive implant works similarly and is placed in the upper
Arm.
and the arm. That's the Nexplanon. Good for 3 years. The injectable progestin is an intramuscular injection that you must receive every blank weeks. It's also available sub-Q. So that would be Depo-Provera. How often do we have to give an injection of Depo-Provera? Anybody know?
Every 3
weeks.
months.
Yeah,
it could be 12 weeks.
12 weeks. Yeah, every 3 months. Not a day later. Okay. All right. 2 weeks later, she comes back for her Makina. Or Marina, sorry, Marina. Or Kylina, depends. So we insert that and we're going to give some education. Okay, what do we want to teach her? It's important that you check for the IUD strings after every menstrual period. Is that indicated?
Indicate.
Contraindicated. What?
Indicated.
I don't know what your book says, but I say it's non-essential.
I think it's indicated.
Is that what the book says? Okay. Be sure to remove the IUD after each incidence of vaginal intercourse.
Contraindicated?
Yeah, you don't want to take it out. It needs to stay in. The IUD will prevent pregnancy, but it will not prevent transmission of sexually transmitted infections. Do you have any questions about how to protect yourself from STIs? Do we need to teach her that?
Yes.
Yes. The calendar-based method of contraception requires that women keep track of the number of days in each menstrual cycle.
Is it indicated?
I don't think so. It's not the number of days of the menstrual cycle. Yes, I'm sorry. I think so.
If you scroll in the notes, it might tell you.
Oh, thank you. It says here, it's important that you do check for the IUD. Thank you, Nicole. I'm just kind of out of it today. And then what else? Let's see here. Indicated. Okay. Be sure to remove the ID. It's contraindicated. Talked about that. The IED will prevent, but it will not indicated. Non-essential, calendar-based, not essential. Okay. Should have gone by my gut feeling, huh? All right. Semen analysis is a common diagnostic procedure related to infertility. in instructing a male patient regarding this test, the nurse would tell him to
A.
can you see the notes?
It says B.
Abstain.
Okay, so avoid intercourse or ejaculation for about 5 days and then produce a semen. That way it's going to be fresh and it's going to be full as much as possible. Okay. Use of a condom. The nurse would recognize the need for further instruction to the male patient if he states that he lubricates the condom with a spermicide containing non-oxynol 9.
Be B.
It's A.
Oh, well.
Yeah, we're trying to determine which one means he needs.
Oh, further
more.
instruction. I didn't read the question.
Yeah. So the answer is A. That kind of spermicide is going to eat through the condom. All right. Alternative methods for improving fertility. Which statement by the nurse is most appropriate when instructing the woman in which herbal preparations to avoid while trying to conceive? Interesting. Never heard of this before.
I will go with B just because of licorice root.
Yep. What
Right.
about licorice root? What about licorice root? What do you know about it? Who said that?
I did, but I remember you talking about it when we first started maternity.
Really? I don't remember talking about it.
No.
Okay. All right. An infertile woman is about to begin pharmacological treatment. As part of the regimen, she will take purified follicle stimulating hormone, FSH, and there's another name for it. The nurse instructs her that this medication is administered in the form of a without looking at the notes, what do you think it is?
IM injection.
Yeah. Does anybody know what other things they use for infertility? What other drugs are being used or hormones? They use HCG and progesterone and clomid, clomiphene. So a woman is using the basal body temperature method of contraception. She calls the clinic and tells the nurse, "My period is due in a few days and my temperature has not gone up." The nurse's most appropriate response is
Huh.
So during ovulation, the basal body temperature does go up. Okay. So she probably did, yeah, she probably didn't ovulate. Okay. Why is it better to purchase condoms that are not lubricated? The nurse's most appropriate response is
Is it B?
yeah. A married woman has made the decision to use a diaphragm as her primary method of birth control. The clinic nurse should provide which instructions regarding care of insertion and removal of the diaphragm?
A, B, and C?
Yes. How long are they supposed to leave it in after intercourse? Do you know?
I
That's
think
a
you're supposed
really
to take it out immediately, right? No, I'm not sure.
6 hours. It needs to stay in place after intercourse for 6 hours before you remove it. And yes, you can use spermicidal inside the diaphragm. Okay, before she inserts it. We show her to fold it in half to be able to insert it. And it usually pops right into place. Okay, the next one and the last one. Discharge instructions after tubal ligation should include. So tubal ligation is a major surgery, okay?
A?
Tubal ligation, huh?
A is one of them.
No,
I don't remember having mood swings.
no. It doesn't
think
affect the
D.
hormones.
D and E. Yeah, for sure. D.
D.
It doesn't affect hormones. It just blocks the channel, okay? So it doesn't change periods, doesn't change the moods. You don't have to worry about any other birth control type, okay? And so it doesn't affect sexually functioning. In fact, it might be more enjoyable because you don't have the fear of getting pregnant, okay?
I mentioned
And E, yeah.
Yeah, you still want it. Yeah, you still want to use condoms if you're having multiple partners. Not a monogamous relationship, you wouldn't have to. Okay. So what I gave you was a PDF form of this, and I don't know whether it has the notes on it or not. So I need to send you the PowerPoint. Okay, that way you'll have the notes. You should have the notes. Okay.
Yeah,
Yeah,
the
the
part
PDF
that-
doesn't have it.
yeah,
I'm sorry. The PDF doesn't have it.
No, ma'am.
Okay, so I'll send you the PowerPoint so you can have the notes. But it probably some of those that even if you have the answers, if you still don't quite understand it, look it up in your book, okay? And then I gave you a couple PowerPoints, but mine didn't cover a lot of that stuff. Okay. All right, it's only 13 after. Any questions? So what do you have due this week? What's your
Got
assignment?
108 questions.
Yes,
So-
week 9 module. It's long. It's only 1% of your grade, but do it
Oh.
anyway.
Oh my gosh.
It'll help prepare you for the HESI. Let's see. Okay. Let's see. New share. All right. So week 9, maternity assignment exam. Next week, you have another one called maternity practice exam. And then, of course, you had your exam today. I'm going to go ahead and open up the practice exam so you can work on that early, okay? Because next week you have NCLEX questions and 2 quizzes. Now, the quizzes that you see in your modules are not KGA quizzes. They're not timed. You take them during your time, whenever you want to take them, okay? Okay, so do a good job because I do have some hefty weight. So, and
Are
there's
they
20
open?
Not now, but I'll open them, okay? I'll open up week 10 so you can get to everything.
Okay.
So next week during class, I sent an announcement that we will be doing HESI review during class. What we'll do is I have a PowerPoint and I might have some other things for us to do. And we have to start the beginning again and just go over everything. Okay, as a review. So some things that I do recommend for preparing for the HESI is only watching all the recordings, but you might have a green one. The HESI NCLEX comprehensive HESI comprehensive NCLEX preparation book, chapter 6 is maternity. It's really good. So you can go to chapter 6 as you study. Okay. And then just doing extra NCLEX questions. Some good ways to prepare for the HESI. Now, if you are, if you've been good about getting your homework done and your homework score is 78%, and your exams are 78%, then you only have to get a 78% on the HESI, right? So, but if you've got high exam scores and no homework, it's going to be tough. Okay, homework really affects it. So do your homework this week. If you didn't do something last week, get it done. Okay. The 56% is better than a 0%. Okay. Believe it or not. What else? So HESI remediation, I'll be putting some information about that. So after you take your HESI exam, in your Evolve HESI account, you'll notice remediation packets. You are sent remediation packets from the HESI according to your score. Okay. And I'll give you the criteria. If you make above 900 on the HESI, you still need to complete 1 hour of HESI remediation. Okay. If you score below that, between 850 and 900, you need 1 hour. Between 800 and 850, 2 hours, and on it goes. Okay. So if you score really low, you might have 12 hours of remediation to do. So if you're taking your HESI on Monday, you have a week and a day to get that remediation completed. If you're taking your HESI on a Friday, you only have Saturday, Sunday, Monday, and Tuesday during the day to get it done. It's due by midnight, Tuesday, week 12. Okay. Week 12, we have no scheduled class. You're working on a remediation, so you need to meet with me on Monday or Tuesday. And what I'll do is I'll put up a schedule and you choose when you want to come. And what you're doing, you're meeting with me and saying hello, and I might give you some guidance. And that will be your attendance for week 12. Now, if your attendance is good all quarter and you've not missed anything, you don't have to come week 12. Okay? You don't have to come, won't hurt anything. But if your attendance is close to 20%, you don't want to miss week 12. Okay? So I'll send you all this information again in the announcements, and I'll probably email you to remind you as well. Okay, and then today's exam, if you score below an 86, you probably should go over the exam with me. Okay. In the past, it's been known that there's a lot of newborn questions on the HESI. Okay. Any questions?
I know you probably said this, but when's the HESI